Knock, knock. Hi, my name's Alexa. I'm going to go ahead and be your nurse today. The doctor went ahead and ordered an NG tube to be placed down to your stomach. Can I have you confirm your name and your date of birth for me? Newman J. Matias, 3/2/1972. Okay, perfect. I'm going to go ahead and ask you some questions. Have you ever had any GI bleeding or any abdominal or GI surgeries? No? Okay, and do you know if you have a deviated septum or not? You don't? Okay, perfect. So I already went ahead and connected my suction canister to suction and placed it on intermittent suction. And I'm going to go ahead and raise the head of the bed to high tolerance position. I'm also going to go ahead and place this pillow behind your back. I'm also going to go ahead and just check your nose to see for any deviation, which I do not see, or any foreign bodies, which again I do not see. I would have already auscultated your abdomen, but I'm going to go ahead and palpate your abdomen, and I don't feel any distension or anything like that. I'm also going to go ahead and occlude one of your nasals, and then I'd have you breathe in. Okay, good. Next one. Perfect. Okay, I'm going to go ahead and place this blanket over your chest, as well as the bath basin. Now I'm going to go ahead and open my NG tube. And I'm going to go ahead and place the, if I were actually to go ahead and place an NG tube down a patient, I would connect it to a syringe so then I could excrete any stomach contents. But since there won't be any stomach content, I'm just going to go ahead and connect this so nothing comes out of either side. And I'm going to go ahead and measure my patient from his nose to his ear, and then from his ear all the way down to his esophagus, and I got 63, so I'm just going to go ahead and do that again, from his nose to his ear, and then from his ear to his xiphoid process. I think I said esophagus, but I meant xiphoid process. Okay, perfect. And I'm going to go ahead and get a piece of tape and mark so I know where to stop. I'm going to go ahead and place it at 65. And I'm going to go ahead and get a pair of gloves on. And I'm going to go ahead and also just grab a couple more pieces of tape for when I'm finished. And I'm going to go ahead and split this one down the middle. Perfect. Okay. I'm going to go ahead and open my lube and lubricate my tubing 3 to 4 inches. Come over here just in case. Okay, so I'm going to go ahead and hyperextend his neck a little bit, and I'm going to go ahead and stick, so you're going to feel a little bit of pressure. Okay, and now that I can see that the nasogastric tube has gone down his esophagus a little bit, I'm going to offer him some water. So anytime that you sip, I'm going to go ahead and advance the nasogastric tube a little bit more down. So I'll have you put your chin to your chest and sip, and then I'll advance, sip, and I'll advance some more, sip, and I advance. So I felt resistance. So I'm going to go ahead and pull down, sip and advance. There we go. Almost done. There's some resistance. Okay. There we go. There we go. Okay. Sip and advance, and we're almost to the stopping point. Good. Okay. So now I'm gonna go ahead and just check with my pen light to see. Good. I don't see it coiling in the back of the throat. Okay. Then I would also use my syringe to excrete any stomach contents out and measure its pH, as well as have x-ray come and check the placement, and they said it was good, so I'm going to go ahead and just advance it a little bit more and clean his nose with alcohol swab just to remove any oils that might prevent the tape from sticking. So I'm going to go ahead and stick the tape, allow the alcohol to dry, and stick the tape on his face. How are you doing? Are you okay? Do you feel any nauseous at all? Okay. And while I'm asking him questions, I'm noting his ability to speak as well as swallow, and I don't notice any difficulty, so I'm going to go ahead and place this on his nose. I'm going to wrap one side. Oops. Okay. I'm going to wrap one side this way, and this side the other way. Perfect. Now I'm going to go ahead and remove this from his wig, as well as the towel. And I'm going to go ahead and just use another piece of tape and wrap it around the tubing. And then safety pin it to his gown. And then I would also just go ahead and leave this like that and remove this and connect it to my suction. And then I would just clean my area, discard of all the things where they need to go, and make sure I wouldn't lay my patient down more than 30 degrees to prevent any like acid to go back down the esophagus. And then I would just make sure that my patient is okay. How are you doing? Are you doing okay? I'd go ahead and place his collet next to him and leave him in high fallers. And that's the end of my NG tube placement video.